It is my absolute pleasure to introduce you to Professor Stephen Davis, who does not need introduction to World Federation Neurology audience. He's a very well-known, strong brain health advocate, former president of World Stroke Organization. Steve, as you are aware, World Federation Neurology and Movement Disorder Society is joining hands together to celebrate 2020 World Brain Day on Parkinson's disease. How excited are you to see that 2020 World Brain Day is talking about Parkinson's disease?
I think this is tremendously important, Tissa. I think awareness and advocacy for further research in Parkinson's disease for our patients who suffer from Parkinson's disease is very, very important. I think that there will be more major advances in the treatment of Parkinson's disease in the years to come. We have some new drugs. I think life for Parkinson's patients has improved, but there is a lot more to be done, and we need this global focus.
Steve, you have basically trained almost half, if not more, neurologists that Australia has, New Zealand had seen over the last 20, 30 years. What is your message to your mentees who are on their own strong advocates now? What should they do for the World Brain Day 2020 from Australia and New Zealand?
Well, I think people should really promote awareness and understanding of all of the aspects of Parkinson's disease. The research opportunities, the awareness of the condition, the complications, the increasing knowledge of the pathology and pathogenesis of Parkinson's disease, some of the genetic advances, and some of the treatment advances. So I think that awareness, knowledge, and enthusiasm for further progress are all very important aspects.
Absolutely, we should invite them to drop into our websites, World Federation Neurology as well as Movement Disorder Society. We have a truckload of toolbox that they can download and use them as if they belong to them. They belong to them. These are their organizations.
Steve, I think use the resources provided for World Brain Day is a great opportunity for the neurological community.
Steve, I'm going to change the tack a little bit. You are a tremendous hero for many of us worldwide. You are an asset to the world. Your contribution is enormous. Let's look back at your life and tell us about your childhood and what motivated you to pursue a career in medicine in the first place. Then we'll come back to neurology and stroke soon.
Well, I was born in London, actually, of Australian parents. So my first few years was spent in the UK. And then we moved back to Australia, where they were from. And I lived in Brisbane and then in Melbourne. And I think I was interested in medicine from early teenage years. I recall being very impressed with our local general practitioner and thinking it would be an interesting life. My parents were not medical. And then when I did medicine, I in fact wanted to be a psychiatrist. And that was my wish. In my whole medical training, I think I was the only person in my group who believed that they knew what they wanted to do with their life. And of course, then I graduated and I greatly enjoyed internal medicine and particularly neurology. So I switched tracks and I thought, well, this is not such a big change. It's still the brain and all of the fascination of the brain, the mystery of the brain, the opportunities. So neurology became my love and my career. And then subspecializing stroke, of course, has been my major theme, but I have a great love for general neurology, I must say.
I know. Then you are very good at it too. Not only you love. And funnily enough, recently I was doing a similar interview with Victor Fung. So I asked from him about work-life balance. His answer was, you do know Steve Davis. I said, of course I know him. He's a good colleague and I know him very well. Once I asked from Steve, how do you respond to each email within minutes? How do you manage work-life balance? And apparently you answered to him saying that apparently Victor is going about telling this all over the world now, mentioning your name also, of course, that, what do you mean work-life balance? So I'm trying to balance my work a little on
Yeah,
life. So
exactly.
you
I
are
have not found
hardworking.
any answers, I have to be honest.
Absolutely. I asked the same question from Peter Gorsby once, as I was doing similar thing with headaches. He turned to me and said that, Tissa, there are two groups of people. Those of us who work and those others who does not work. I don't know about this work-life balance business. I can tell you that I have never seen any burnout business ever in my life.
I think we're very lucky to be neurologists. I mean, it is an endlessly fascinating discipline. I think it's the advances we've seen in, well, certainly in my career, have just been extraordinary, and very, very lucky. Every day is interesting and challenging. And of course, neurology doesn't become any easier. It becomes, every patient has variations around the theme, don't they?
Absolutely. This is very important, Steve. We now know that neurological disorders are the leading cause of disability worldwide.
Yeah.
We also now know that it is the second leading cause of death, thanks to
Yeah.
stroke being classified as a neurological disorder rather than a cardiological disorder. My question to you is, especially with the younger generation and all the new things happening, the fact that we live in the middle of a pandemic, we hear stories to be concerned about things rather than the other way around. I like to go back. When you wanted to do stroke medicine, it was almost non-existing. I mean, we have the luxury of offering all kind of fancy treatment and other things now, but you didn't have any one of those things, let alone the talking big about them. Yet you started the journey pretty much from the scrap. What inspired you to get into stroke? And tell me some of the challenges that you faced at that time, and what was your strategy to overcome them?
Well, I chose stroke because I found, I guess, the relationship between blood vessels and brain function to be very, very interesting. And also because it was a big problem. I didn't want to go into a kind of rare neurological condition. I wanted something where any impact that and any small contribution I could make might have a greater impact. And I found it fascinating. Also, the fact that, as you said, there wasn't any acute treatment at all, and there was very little preventative treatment. We knew about blood pressure, we knew about some general vascular risk factors, we knew about transient ischemic attacks, and we fairly recently learnt about the importance of large artery carotid disease and treatment, but really not much known and absolutely no treatment at all. I think one of the frustrations I had was it was shown in the 80s and certainly very, very definitively in 1993 by Peter Langhorne that stroke was eminently treatable and one could have an immediate impact even without modern drug therapy by putting patients in a specialised stroke unit. And that reduced mortality by about 20% and was cost effective. And every domain that you measured, every parameter improved with stroke unit care. And I think it was one of the challenges for me that although many of my colleagues were early adopters, there were some that were not early adopters. And there was a lot of resistance to the development of stroke units, particularly by some general physicians and even some neurologists who weren't interested to look after acutely ill patients. And I think once we started to be able to treat patients in a specialized way, and then we could try out some really exciting new approaches to the treatment of stroke with high quality clinical trials, the whole game changed. And I think that was the case with thrombolysis and more recently with large artery occlusion and thrombectomy. Dramatic changes that really, I think, none of us would have foreseen a quarter of a century ago.
And one of your other magic was attracting all kind of clever people from all over the world to Melbourne. So when you set up stroke services at Royal Melbourne Hospital long time ago, you probably did not wish this to occur, that people would come to you from all over the world to train in stroke medicine. We won't go and mention those names. Everybody knows when they write and whom I'm talking about. How easy was it to convince the management to set up a stroke service and build a center of research excellence? Did you have that dream fairly early on, or it naturally came as you continued to deliver high quality papers and really exceptional translational research?
Well, I just make two comments. I've always believed that the best quality clinical care is underpinned by research excellence. The best outcomes from really good centres are informed by high quality research done in that centre. So it's research-led excellence was the sort of mantra that I've always believed in. And in the early days when we first established a stroke unit, I established a small 4-bed clinical trials unit, and then that gradually expanded. As far as people coming from all over the world, it's been one of the great pleasures and privileges of my life, because I believe there is far more in common between us than what divides us. And I have enormously enjoyed having younger colleagues from virtually every part of the world. I feel I've learned far more from them than they've learned from me, to be perfectly honest. And I don't just mean about neurology or stroke, but about life in general. I do think that there are some core human values that bind us. And it's quite extraordinary to me when I travel and you see the lifestyle of colleagues, and it might be in Asia, in Russia, United States, South America, Middle East. There's just so much in common, and most of us work too hard. We try and have that work-life balance with families. We're worried about our kids. We worry about our parents. And you know, it's been a great lesson for me that really I think the commonality. You know, they always said when we were in medical school that medicine, life is like a theatre and doctors have front row seats. I think nothing is more true.
Absolutely. Steve, for the record, we should remind our viewers that although you work very hard, you are happily married, and I have visited your place multiple times, and you have wonderful children, wonderful wife.
Thank you.
Tell the audience a little bit about your family.
Well, I have my wife is a judge in Melbourne at the county court. I have two children, both in their 30s, both married, and we're awaiting grandchildren. Not yet happened. My son works for a not-for-profit in strategy. He's a wonderful young man and very intelligent, and we share many interests, football and certain aspects of music, and we're very close. My daughter is an interior architect. My son married a training cardiologist. My daughter married an accountant, and yeah, we're a close family. Which is, we're very, very fortunate. My mother is 97. She's still alive, and she still is cognitively pretty good. She lives alone with some help. And my dad died when he was 90. He had dementia, and I think dementia is the other, apart from stroke, neurodegenerative diseases like Parkinson's disease, which we're talking about, are the great challenge for neuroscience. We have to crack these diseases. We've got to crack dementia. We've got to find the answer to altering the natural history of Parkinson's disease. And I would say to young neurologists who might for some reason be watching this is exciting. You know, who knew in stroke that getting blood flow back into the brain quickly was going to completely transform the natural history and the outcome? And I believe that the same advances will occur in neurodegenerative diseases, but it needs a lot of energy, enthusiasm, good laboratory work, good translation, good clinical trials, good clinical neurology to shift the radar, to shift the outcomes. It'll happen.
100%, you hit the nail on the head. Even this pandemic, when I went to see a hairdresser recently, she was saying that how stupid and how bad we were as a community when we were having those uproar for toilet issues and this and that. I just reminded her that I didn't tell her who I was, but I told her that it's all coming from brain and our behavior. And
Yes.
we have to crack these things, and that's the only way that we can overcome this. And when we look at the history, after every pandemic, humans prevailed. We are good adapters, and we can adapt well and become good. And let's hope that this is the next phase of development for neurology and all those disorders that you mentioned. One other question, Steve. One of the criticism that I'm hearing from the young neurologists in particular is, yes, research is important, but it is very hard, and we don't have time or money or support. I know that things didn't come on a silver plate to you either. Tell them your secret. How do you overcome these the difficulties at the early on when you board certify as a neurologist and when you really want to adopt these strategies, bringing trials to the table? What's your tip to them?
Well, I think that research training is incredibly valuable for anyone, because you think about patients differently. You think about hypotheses and testing the hypotheses in a patient so it actually improves your patient care. As far as how difficult it is in terms of your clinical practice and your life, I think the first thing is that it is intensely rewarding, and to spend a period of time early in your career doing research, whether it's in the lab or in the clinic, it sets you up for opportunities in life. And whether you become a full-time researcher or, like me, someone that's always done it part-time, it can be very, very gratifying. And I think the way to think about it is not separate to your clinical practice, but intertwined and underpinning your clinical practice. It's also about collaboration. Virtually no modern research is done in isolation, but it's a tremendous opportunity to work together with colleagues in your institution, across other institutions, nationally, and ideally internationally, because frankly, it's a global business, and we need to think globally. And the rewards in terms of what we were talking about, friendships, making progress, learning about other cultures, learning about other lifestyles, is extremely rewarding, and I think can be integrated into a professional life.
I think it is important to mention one of the greatest contribution of Steve is, I always tell when I talk about other fields in Australia, we must take Steve and Jeff as an example. They have shown this country how you do things together. You are the perfect collaborator, Steve, that anyone could wish for. I had the good fortune of collaborating with you on multiple the trials in the past, and you support everyone almost on equal terms. You provide authorship to your collaborators, you recognize them, and you give them something to take back to their institutions. And you, I think, remind how to get good collaborators. What's the secret from your own experience?
I should mention, I think finding a good collaborator or a group of collaborators is the key. I was very fortunate. Jeff Donnan and I were in the same year of University of Melbourne Medical School, and then my dog is just coming into the room. And then we worked together as interns, and then we became, we were good friends, but we became collaborators, and we followed a fairly similar research path. And then when we both returned to Australia from the United States, we started collaborating together. That was in the early 1980s. So it's a long time ago, but we're great friends. And I think it's a synergy. If you work with someone closely, you can achieve far more than just adding the two parts. It really is a synergistic relationship. And I've been very fortunate to have that friendship and collaboration with Jeff Donnan.
I totally agree, Steve. I think people should take a lesson from your life and remind themselves that it's not about competition. The real competition in 21st century is actually collaboration. If you really wanted to be truly competitive and have the edge, you just need to be the perfect collaborator. Then very difficult for anybody to stop you from
I also
great things.
want to say, Tissa, how much I've enjoyed our friendship and collaboration over the years, and the fantastic work you're doing in neurological education and advocacy. I've found it always very impressive.
Oh, thank you very much, Steve. As you know, when we did the Donald Davis advocacy course, we only managed to do that only 2 years because we were all busy. But when I look back, over 70% of the graduates of those 2 courses are full professors now, wherever they are. So at least we attracted the pretty decent crowd. Let's see whether we can resurrect that later on. Steve, thank you very much for your time.
Pleasure.
Before we finish off this conversation, to remind people that there is life outside medicine. You have a lot of other extracurricular activities. So how do you pass time despite your work?
Well, I must say, probably partly because I'm interested in stroke, I believe one has to try and stay fit. So I do some jogging. I love skiing, but I've had a couple of bad knee injuries skiing, so it's held me back a little bit, but I enjoy physical fitness. I like to watch movies. I like to read. I like theatre. I like music, opera, ballet. It's very interesting. There's so much richness in life to pursue and embrace. And I often think, when I look at colleagues who are wonderful musicians who sail boats, I don't have those skills. I would like to have them, and maybe there's still time in life to develop some of them. But life is is full of richness and one to be enjoyed, I think.
Steve, thank you very much for everything that you have done to this world. You have basically moved stroke medicine miles where we used to live as medical students to where we are now. And you continue to do that. And we wish you all the very best. And we are incredibly proud of your work. And as I said, you belong to the whole world. You are a global asset. And thank you for supporting this World Brain Day campaign, sharing some of the up close personal things with us today. Have a wonderful day, and stay safe and stay well.
Thank you, and all the best to everyone watching. Thank you.
Thanks.